Today is a sad day. I have to report that the NDIS has yet killed another NDIS participant because of inadequacy and lack of funding and simply lack of care and diligence. My name is Patrick Hutzel from intensivecareathome.com, and today, like I said, I have to announce that the NDIS, the National Disability Insurance Scheme, and Bill Shorten at the helm of it have killed another patient in the community. Let me explain. One of our clients who's got cerebral palsy was a young adult and was living at home with the parents, was BiPAP dependent. BiPAP is a mode of mechanical ventilation with a BiPAP mask. This was also a client who had chronic lung disease as part of the cerebral palsy and upper airway obstruction, and many other comorbidities such as urinary retention and recurring urinary tract infections. Now, when we first started to engage with a client a few years ago, we were doing maybe between 1 to 5 night shifts a week, knowing full well that with the client's BiPAP dependency, it was not enough, and we knew that the client is at high risk of dying when we, as intensive care nurses for a client on BiPAP, are not there. Now, the NDIS, as we went along in caring for our young client, the NDIS had the gumption as we went along to cut some of the nursing funding, making a vulnerable client needing intensive care nurses 24 hours a day, which is, by the way, evidence-based when someone is on a ventilator at home. And I will refer to that in this blog post in the written version. Go to intensivecareathome.com and look up the evidence-based mechanical home ventilation guidelines. It's clear that when someone is at home on a ventilator, on BiPAP, on high BiPAP support with oxygen dependency, it's evidence-based and research-based that only critical care nurses with a minimum of 2 years critical care nursing experience can keep a client safe at home. So the NDIS had the gumption to remove some of the funding. We were doing some of the advocacy to the NDIS, but it was ignored. Fast forward, we were also then providing an NDIS nursing assessment, an independent NDIS nursing assessment done by a critical care nurse with a legal nurse consulting background. And that independent NDIS nursing assessment clearly highlighted that this particular client needed 24/7 critical care nurses to keep the client alive and out of hospital. So it is a life-saving measure, right? And it is also much more cost-effective compared to keeping a client in ICU. Now, let me read an excerpt from the nursing assessment so that you can understand how severe this situation was and why the client in the end. So one excerpt from the nursing assessment is having critical care registered nurses, CCRNs 24/7 is reasonable and necessary to provide safe and high quality evidence-based direct clinical care for the NDIS participant. The CCRN is a clinical nursing role who leads by example and demonstrates nursing values and well-developed professional, clinical, and people management skills through collaboration, encouragement, support, information, and knowledge sharing. The CCRN is the central contact point for all staff to ensure consistency of the care for the client. Consistent care is the ability to provide uninterrupted care or services across all care programs and practitioners over time. The Australian Institute of Health and Welfare states that continuity of care leads to fewer hospital admissions. This is consistent with the client's goal of remaining well at home so the client can participate in and achieve their goals. The CCRNs would be responsible for the following tasks, which are vital to support the client's disabilities: planning, managing, and attending reviews and appointments such as the general practitioner, medical specialist, allied health, in conjunction with the parents, or when the parents are unable to attend, consulting with specialists, allied health, and other relevant disciplines to facilitate high quality care and early interventions of clinical concerns, supporting clear communication to and between all staff working to support the client. Now, This was all denied by the NDIS, and that's one of the reasons why the client passed away. It is gross negligence. I go as far as that this is a deliberate attempt to take someone's life, and unfortunately the NDIS has succeeded. And the NDIS is now, broadcasting almost every week how much money they're saving, and by letting people die that are on the scheme because the people are not getting the support they need, that is how they also save money. And I go as far that this is potentially murder, and I'm not mincing my words here. Furthermore, the nursing assessment continues. Having CCRNs 24/7 that are experienced and appropriately qualified healthcare professionals will improve the health and well-being of the client, prevent unplanned hospital admissions, improve staff retention and morale, improve the safety and quality of care support provided, and support the life goals of the client, which are all consistent with the NDIS practice standards. So the NDIS is not following their own advice, and is just interested in cutting costs even when people are dying because of it. The next section of the nursing assessment is also very interesting. The client had bronchopulmonary dysplasia, a chronic lung condition developed as part of the condition at birth, which has left the client with permanent lung damage, tissue destruction, and very small alveoli. As a result, the client requires ventilation support with BiPAP via face mask and also oxygen. The IPAP on the BiPAP was 16 and the EPAP was 7, and with a backup respiratory rate of 16. Now, anyone that's an intensive care nurse understands, or intensive care doctor or intensive care physio understands what I'm talking about here, right? And can you imagine that the NDIS wants support workers to look after a patient with those settings? Now, that is negligence at its best. I do believe that people need to go to jail who have made those decisions, because they're deliberately killing people. Now, this particular client nearly needed 24/7 BiPAP support, could barely be off the BiPAP and the oxygen, and therefore also needed consistent monitoring via oxygen monitor and heart rate monitor. And again, a support worker wouldn't know what to even look for, right? It's absolutely dangerous. And that is why this resulted in, unfortunately, in a death of an NDIS participant. Now, to cut a really long story also a little bit shorter here, the client, when the NDIS cut the nursing support down to one shift a week, right? The client went into hospital more and more frequently because support workers simply could not keep the client at home predictably. Our clients that are 24/7 nursing funded for their conditions when they need critical care nurses at home, they don't go to hospital. That is part of our KPIs, that is part of our promise. When I say they don't go to hospital, I am talking about non-elective hospital readmissions. We know how to keep our clients home predictably. That is what makes us unique. Now, when someone is on a ventilator at home, you need to look up volumes, you need to look up oxygen saturation, and same in ICU, and you need to know how to interpret those numbers, right? You also need to be able to listen to the chest and auscultated chest and make decisions from there. You need to know when to give the right medications, when to give a nebulizer, when to make sure that you can drain secretions from a chest, because this client had many hospital readmissions, including hospital readmissions for chest infections, right? Now, on the last hospital admission that the client had from a chest infection, it became clear that the client won't survive, and then went home for palliative care with our service. But the client probably wouldn't have gone to a hospital in the first place if the client had critical care nurses 24 hours a day, as was strongly recommended by the independent NDIS nursing assessment, and the NDIS blatantly ignored professional advice. As we all know, the NDIS is full of bureaucrats and not full of clinicians. We as clinicians make recommendations and the NDIS ignores, and therefore quite a few people have died in the last 10 years. There are at least 8 or 9 people now that I know of that have died under a support worker model where CCRNs would have been needed, critical care registered nurses, and the NDIS thinks they can send support workers instead. That is like flying the airplane with a cabin crew instead of the pilot. We know what happens there. Now, when the NDIS ignored the independent nursing assessment earlier this year with the evidence-based recommendation for critical care nurses 24 hours a day, I went to the Quality and Safety Commission and submitted an incident report basically saying that this particular client is at high risk of dying because the NDIS ignores the advice from a healthcare professional, from a very experienced healthcare professional. Now, the Quality and Safety Commission, acknowledged the incident, but never did anything about it, right? Why does the NDIS have a Quality and Safety Commission if they're not doing their job, right? That is a very relevant question here, right? That is a very relevant question. Now, what we are doing as part of our due diligence now, of course, is we are reporting this, or we have already reported this to the coroner, right? Because this, we think, must be a coroner's case because of NDIS negligence. And I hope Bill Shorten and his bureaucrats are sleeping well at night. This is a very young NDIS participant that passed away, one of many, and the NDIS has blood on their hands, right? And it's getting more and more. And I wonder when Bill Shorten and his bureaucrats will be held to account and will be taken to a court for, killing people. That is what's happening, and that is the reality. The NDIS deliberately wants to keep standards low in the community and treats their NDIS participants as second-class citizens. It's crystal clear, right? They have no interest in quality providers. All they want is cheap providers with no standards, with no quality standards, right? We are the only service in Australia in 2024 that has achieved third-party, including NDIS accreditation for intensive care at home nursing, right? And there's no other provider bringing a higher skill level into the community than we do, right? With intensive care at home, we are providing 24 hours critical care nursing at home, and we provide a genuine alternative to a long-term stay in intensive care for mechanical ventilation, tracheostomy, home BiPAP, home CPAP, ventilation without tracheostomy, tracheostomy without ventilation, home TPN, and home IV potassium infusions, home IV magnesium infusions. We're also providing palliative care at home. We're also providing ventilation weaning at home, tracheostomy weaning. We're also providing central line management, PICC line management, as well as Hickman's line management. We're also providing nasogastric tube management and PEG tube management at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District In Touch program, saving approximately $2,000 per patient that we keep at home instead of letting them go to ED. We're also in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs around $5,000 to $6,000 per bed day. Our service costs between $2,500 and $3,000 per bed day, and we're freeing up a much needed and in-demand ICU bed, and we're improving the quality of life for patients and their families. So it's a win-win situation all around. With intensive care at home, we are currently operating all around Australia and in all major capital cities, as well as in all regional and rural areas. We are an NDIS approved service provider all around the country, TAC and WorkSafe in Victoria, iCare in New South Wales, NIISQ in Queensland, Department of Veteran Affairs all around the country. Our clients and we as a provider have also received funding through public hospitals, private health funds, as well as departments of health. Like I said, we are the only service provider in Australia that has achieved third-party accreditation for intensive care at home nursing in 2024. We've been achieving this level of accreditation since 2012. No other provider has achieved this high level of accreditation in the community and has created more intellectual property for intensive care at home than we have. And that puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia. No other provider in Australia can take on a higher acuity safely in the community than we can. And if you're at home already and you're watching this and you realize that you don't have the right level of support, I will give you a tangible example here. One of our first clients over 10 years ago was a client who was at home on a ventilator with a tracheostomy, with a support worker model. Of course, support workers, just like I said today, can't keep a patient at home on a ventilator with tracheostomy. That's like flying the airplane with a cabin crew instead of the pilot, because this client was at high risk of dying and he was going in and out of ICU because support workers simply don't have the skills, the experience or knowledge how to look after the ventilator and the tracheostomy client. It's an intensive care and critical care nursing skill, full stop. Then eventually the client found us and we were proving our concept with this client very fast. When we worked with the client and we sent him intensive care nurses 24 hours a day. He never ever went back into ICU ever again, and he was safe. We can do the same for you if you're not safe at home, including the advocacy that goes along with it to get the relevant funding. We have always successfully advocated for our clients, otherwise we would not be in business. That's also why we're providing level 2 and level 3 NDIS support coordination. We have a team of NDIS support coordinators and they have a wealth of knowledge. I will put into the written version of this blog to an interview that I've done with Amanda Riches, who's one of our NDIS support coordinators. We're also providing TAC case management, WorkSafe case management in Victoria. If you're an NDIS support coordinator or a case manager from another organization watching this, and you're looking for nursing care for your participants, please reach out to us as well. If you're looking for funding for nursing care for your participants and you don't know how to go about it and what evidence to provide, I encourage you to reach out to us. We can help you with the right level of advocacy. We also provide NDIS specialist nursing assessments done by critical care nurses with a legal nurse consulting background. And if you're a critical care nurse and you're looking for a career change, we're currently hiring for jobs for critical care nurses in the home in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, and in Warragul in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients will have the same staff coming over and over again because they are so vulnerable and so special. And that's why we need regular staff. So if you're looking for agency work where you can come and go, this is not the right fit for you. We're looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts. And if you're really keen on building relationships with us and with our clients, you're welcome to apply. Otherwise, it's not going to work. And if you're an intensive care specialist or an ED specialist, we also want to hear from you. We are currently expanding our medical team as well. We can also help you eliminate your bed blocks in ICU and ED for your long-term patients or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. And even if you do pay for it, it's much more cost-effective than what you're paying in ICU or in ED. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, respiratory wards, etc., please reach out to us as well. We can help you there fast. And if you're in the US or in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and leave your comments below what you want to see next. What do you think about today's topic and what insights you have from this video? This is a particularly important video that you need to share with everyone, with all your friends, because the NDIS needs to be held accountable. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.